Hello, my name is Kayla Thompson, and I am currently in the Bluefield State Bachelor's Program of Nursing, and I will be giving you guys a presentation on scabies. Scabies is an infestation of the skin by the human itch mite known as Sarcoptes scabi var hominis. The mite burrows into the first layer of the skin and lays her eggs. This skin disorder has been around for many years, dating back all the way to the Egyptians. It is very common among all populations. People have stereotyped that only dirty people or those living in poverty can get the disease, but this is incorrect. Everyone is at risk. It is spread by direct, prolonged contact with the affected person, which is the most common, but it also can be contracted by indirect contact. After being exposed to the presentation of the disease can vary. Those who have never had the disease may not show any symptoms for 4 to 6 weeks, whereas those that have had the skin rash may show signs after 1 to 4 days. The signs and symptoms are few, but include itching and a pimple-like rash. The rash appears as small, red, raised bumps. The most common places to start your assessment are in the creases of your body. The rash is usually small, dependent upon the amount of mites that are present. Other common places for the rash include between the fingers, the elbows, the wrist, the genital areas, and the shoulder blades. Diagnosis of this disease is usually made based upon the appearance and the location of the rash. Scabies is not usually confirmed, but can and should be whenever possible. This takes place by examining the mite, stool, or egg which was found on the skin underneath a microscope. Scabies is usually non-fatal disease that can be easily treated if symptoms are recognized early. Complications are possible though. For example, if the person has performed excessive scratching, this leaves the rash open, leaving room for bacteria to reside. Some of the complications from a bacterial infection include multi-organ failure, renal failure, lymphangitis, lymphadenitis, cellulitis, and sepsis. Another complication is known as Norwegian crusted scabies. This is a severe case. It usually affects those that are immunocompromised, the elderly, the disabled, or the debilitated. This occurs when the rash becomes crusted, which means the site contains multiple mites at this time. This form is very contagious and can lead to outbreaks, especially in facilities such as nursing homes. Treatment for scabies include a scabicide cream. There are multiple available but must be prescribed by a physician. You cannot buy this over the counter. The cream has strict instructions that should be followed accordingly. The cream should be applied from the neck all the way down to the toes and left on the body for the allotted time frame. The person then will shower and wash off the cream. This should eliminate the infestation. If itching and rash occur again or for longer than 2 weeks, a second treatment should be performed. Other treatments may be needed if the rash spread to a bacterial infection, such as antibiotic therapy. All those in the household should be treated to prevent reinfection. Clothing needs to be washed in hot water and dried with hot heat. All furniture and carpet should be thoroughly vacuumed. Mites die after 2 to 3 days of being off of the human skin, so fumigation is not usually necessary. As a nurse, prevention is a very important part of the disease process. Prevention is broken down into 3 different stages. The first is primary prevention. This stage is crucial because it helps eliminate the transfer of communicable diseases. This stage requires adequate education from the nurse to ensure that those around fully understand the disease process. During primary prevention with scabies, the nurse will need to educate them on the risk factors of scabies, how the disease is spread, and what the infection looks like. The next stage is secondary prevention. This stage is used for early detection of the disease. The importance of this stage is to provide early treatment and help prevent further spread of the disease. The nurse's role during this stage would be screening high-risk individuals, which includes those in crowded areas, those that already have rashes, and those who are immunocompromised. The nurse needs to look for skin rashes and follow through to make sure that the proper medication regimens are given and taken properly. The nurse is also an educator in this phase while also encouraging the patient and the family about their current disease state. And the last stage is tertiary prevention. This stage is not readily used by community nurses because most people recover easily without any complications from communicable diseases. The nurse's usual responsibility during this stage would be, though, to help the patient function at their highest level following the disease. With scabies, the role of the nurse could involve helping the patient understand the complications of the disease, such as if a secondary infection was present. The nurse could ensure that the patient reaches their optimal level of healing and function with the proper antibiotic therapy. The nurse can also educate the patient about complications experienced and make sure they have a full level of understanding. Other levels of prevention include meticulous hand washing to make sure the bacteria or the rash is not spread to others, avoiding direct contact with those that are infected, and not using other people's personal hygiene products as their own. In conclusion, scabies is a widespread disease that can affect anyone. It is very contagious and is spread by direct skin-to-skin contact or by coming in contact with the affected materials touched by those affected. Treatment is rather simple, but must be followed strictly to ensure cure and killing of the mites. Prevention is very important at all 3 stages to avoid epidemic outbreaks and worsening of the symptoms. The nurse must be involved throughout the entire situation to ensure proper education is being provided and adequate understanding from the patient follows. Thank you guys so much for your time.